orthopotic assisted technology, again, has been around for a number of years, nearly 10 years, and has gone through several iterations, this being the third, so they continue to improve it. It originally began for partial knee replacements and then progressed to hip replacements, and now we can do total knee replacements. In general, the patient, if they wish, and they're a good candidate for, I mean, they're healthy and fairly vigorous, then they could go home the same day of surgery. We are doing that. But in general, most people still stay one night in the hospital and get to go home the next day. We do these surgeries under spinal blocks. We also are using intra-articular injections or periarticular injections to help with pain relief, as well as some other anesthesia modalities that really have come of age lately that are helping us make this a much more comfortable process, easier for the patient, quicker recovery, quicker to rehabbing, and that's very important to make sure we're progressing to a healthy joint. The age of the patients in general, traditionally, we would have liked folks to be a bit older and maybe in their 60s, but over the last 10 to 15 years, the ages have definitely been dropping. We want these components to last as long as possible, and of course, if we're lowering the age in the population that we would do joint replacement surgery, we need to have those last a long time because people are living a long time, and we really only want to do this one time. So we want to get it as perfect as we can. The computer navigation and the robot-assisted arm, I mean, that is the latest, best technology that we have right now. And because of that, more and more people in their 40s and 50s that have bad, debilitating, painful knees and hips and shoulders are proceeding to joint replacement, and we are seeing very good results. Of course, most of those people are very healthy and vigorous, but they're also going to put more stress on these joint replacements because a lot of them are still working and doing activities that 30, 40, 50-year-old people do, and we need those joints to be able to stand up to that for a long time.